So we have to do the knee movements. Okay. For knee movements, I am holding the heel with my right hand and my left hand is under the patient's knee. Okay. So knee flexion is always combined with the hip flexion. Okay. See the hand movements, my left hand movements. While starting the knee flexion, my hand is under his knee. Okay. But after the knee full flexion, it goes above the knee and then when it comes down to the couch, it comes under the knee. That is, it slides back to the knee to support the knee. You should not do like this alone. Okay. If you do like this, the patient's limb will be unsupported and it will fall on the couch. Okay. It's not good. Okay. So and if you don't slide your left hand over the knee, your hand will get trapped under the leg. Okay. That also is not allowed. Okay. So it has to slide like this. See. So this should be smooth and relaxed. So knee movements are over. Next is hip flexion. Hip flexion is already combined with the knee flexion. Okay. So the other movements you have to do. Since hip joint is connected to the pelvis, while doing the hip movements, you have to stabilize the other side of the pelvis because there will be unwanted movement in the other side of the pelvis. So keep the other leg in slight abduction and in neutral rotation. Okay. So this will stabilize the other part of the pelvis. Okay. Hold the patient's leg with the left hand under his knee and the other hand under the heel and then take into abduction and then adduction. So if you want to achieve more adduction, you can have the other leg in more abduction and then take it into more adduction. Okay. Abduction, adduction, abduction and adduction. Okay. And then for rotation. For rotation, you can use this grasp. Okay. So one under the distal thigh and one under the distal leg. Okay, and roll. Internal rotation. That's okay. External rotation. Okay. Internal and external rotation. Internal and external rotation. Okay. This you can use for any patient, but if possible, if there is a possibility of flexing the hip and knee to 90 degrees. If the patient is allowing, if the patient doesn't have any other problem, he can flex like this. Okay. So hip in 90 degrees and knee in 90 degrees, and then you can rotate the hip. External rotation, internal. Okay. So this position is not possible in all the patients. If possible, you can use this position. Otherwise, use the other roll. Okay. So all the movements are only circumduction is remind. Okay. So start with abduction, external rotation, flexion, adduction and extension. Okay. See? So like this. Okay. And then like this. Okay. So circumduction you are supposed to do in the other opposite direction also. Okay. So adduction, flexion, external rotation, abduction, extension. Your hand sliding should be smooth. Okay. So all the hip movements are over. So all the movements in the supine lying are over. Okay. So and have the patient in side lying. So have the patient have the elbow in bent position, fully flexed position. Okay, and hold the elbow, bent elbow with your right hand. Okay, and or you can have this position also. Okay, if you want to support the wrist. Okay, and hold the clavicle and abdominal process like this. Okay, this grasp is for elevation. Okay, and then for depression, this hand becomes the moving hand and this hand becomes the stabilizing hand. Okay, depression, shoulder elevation and shoulder depression. Okay, and hold the same, have the same grasp, and this hand becomes the moving hand. Okay, for protraction and retraction. Protraction and retraction. Protraction and retraction. Okay. And since we can't achieve full elbow shoulder extension and hip extension, we can use the side lying for both the extension. Okay. For example, shoulder extension. Okay. Fully achieve the shoulder extension. Okay. And for hip joint also you can get the full extension in side lying. Okay. So for hip movements, you are always supposed to stabilize the other side of the pelvis. Okay, have that in the mind. Okay, for that I am just keeping the other limb in hip flexion and knee flexion. And see, I am holding his knee with my right hand and I am cradling his lower leg with my forearm. Okay, and I am stabilizing the pelvis over the ASIS. Okay, hold like this. Okay, and then fully extend. Have the pelvis and spine straight. Okay, and then you can do flexion also, and then full extension. Okay, flexion, extension, flexion, extension. Okay, okay. So all the movements for both upper limb and lower limb are over. Okay, supine lying and side lying.